Hi everyone, welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist. Today we're going to start a new topic. The new topic is about hot flash. Right. Then we're gonna discuss hot flash, continuing every morning and share with you what is hot flash. This is today main one, and how long does the hot flashes last, and what causes hot flashes. What causes hot flashes, right? And what trigger hot flashes? Right? Yeah, we're gonna talk about what trigger hot flashes and how to prevent hot flashes. Then what is a quick relief method for hot flashes, and then treatment, hot flashes treatment. And we're going to talk about acupuncture, Chinese herbs, Western medicines, all those things. Okay. Then for now, we're going to talk about, well, in the treatment, right? That's hot flash with replacement treatment therapy. Then we're going to talk about what hormone replacement, that option that you can do. And what about lifestyle change? Can lifestyle change help improve your hot flashes? Okay, we're gonna talk about all this topic day by day, every morning, right? Then today is what is hot flash? That is the main one, right? Hi, you see that Eric, Veronica, and Jin Lin Hua. Nice to meet you guys. Thank you for joining in. Just checking out the YouTube. Yep, the YouTube is going. That's good. All right. The last thing I need to do here is the Instagram. There's another Instagram. Hi, happy day. How are you? All right. It's getting warmer here now. It's not so cold. It could be cold if you weigh less. Okay. Now, if you're here, please say hi to me and give me a thumbs up, and as well as share this live video. Thank you. If you watch replay, then normally you can fast forward. That you can speed up the video. Okay. Right. Let's start with the new topic today. Is what is hot flash? Now, hot flash is mainly happen in women. Okay. And so a lot of women suffer from it when in the age of it can be before 40 years old. It's about 1% when women go to menopause. Okay, before 40, and about 5% of women undergo menopause between the age of 40 and 45. Okay, and this, whether you get menopause with hot flashes between 40 and 45 or before 40, and this is all considered as with earlier menopause. You know, when do you normally get menopause? It's about 49. It's about 49. Okay, so suffer from menopause, people will think of this as normal. It's not normal. It's not normal, but common. A lot of people suffer from it. It's a sign of your period gonna stop and the hormone change in your body. So with premenopause, that two symptoms that common occur, that is hot flush as well as sweating. Now, the sweating is more likely happen at nighttime. So you heard a lot of night sweats. So these uncomfortable symptoms, right, affect approximately 3/4 of all women. That's a lot in premenopause. Premenopause is the time before actual menopause. The time before actual menopause. Okay. Once a woman has reached menopause, she may continue to have hot flashes for 6 months or up to 5 years. That's a lot. That we're talking about a common one, okay? And in some women, they may suffer hot flashes even longer. How long? It could over 10 years. Yes, it can over 10 years. This, according to the North American Menopause Society, right? There's a society. This number is according to North American Menopause Society. Okay. Then let's talk about what is a hot flusher. What is a hot flusher? A hot flusher is a feeling of intense heat, okay, not caused by external sources. What does it mean, not caused by external sources? Which means it's not because of the weather is hot. It's not because you got a heat pack. It's not because the heat pump is too high, the temperature you turn on in the winter, you put up too high of heat pump that get you hot flusher. It's not because you have too many blankets give you hot flusher. No, it is not. Okay. It's not from the external sources. It's actually internal, come internal. And women who suffer from hot flusher, they always ask around, do you feel hot? Nobody feel hot, and just she's the only one feel hot and sweaty. And patient, if that happened during the day at work, in front of friend, and they get redness in the face and sweaty, and they feel very hot and get frustrated, and then they feel embarrassed. They feel embarrassed because they get all red face. Okay, so hot flushes can appear suddenly, or you may feel them coming on. So it can just happen, or you can feel, oh, it's coming. You can feel it step by step come to a very high intensity and go slowly. Okay. So what are the signs that with hot flashes, tingling in your fingers, your heart beating faster than usual because it's hot, your skin feeling warm, suddenly, your face getting red and flushed, the skin in the face, sweaty, especially in the upper body. And I want to tell you that hot flushes, I ask all my patients, and very rare that a patient will have all body hot and many in the upper body. Well, no one can explain that, but Chinese medicine can explain this because hot, the heat's always going up. That's why it only happen in the upper body. It can be a hand, face, from chest up there, and the sweaty is mainly from here up there. And while you're having hot flushes, you may find, oh, your feet are still cold. And some of them, the hands are still cold. But yes, there are some patients who suffer from hot flushes. The upper body, including hands, extremities, and face, are hot and sweaty. But the lower body, which below your belly button, are all cold. They feel hot in the upper body, but the feet are still cold. Sometimes they just feel hot on the face and chest, but the hands and feet are still cold. And why is that? Now in Chinese medicine, that is because the kidney yang deficiency. When the kidney has not got enough energy, the energy couldn't go into the kidney, deep in the kidney, then the energy, heat, can't go in, and it has to reflect outside. Then it actually come out to the upper body. So it's the energy that in your body is to stay inside of the kidney, but it can't. Instead, it came out, and because the heat normally go up, so it go up to the upper body, and that's what happened. And we just mentioned that hot flush, menopause, it comes with two very common symptoms, which is hot flush and sweaty. And I want to tell you, hot flush is actually the main one. Sweaty, you may not get sweaty. It can go with hot flush, no sweaty, or hot flush, sometimes sweaty, or hot flush, sweaty only during the day or not at night time. But most people happen more in the night time. But there are some cases, many happen during the day, not at night time, which means they have a good sleep, or occasionally they have hot flashes while asleep or sweaty. And some people opposite. The hot flusher is not a main problem, but only sweaty. The sweaty is a real problem for them. The hot flusher, the intensity of hot flusher is not too bad, just a little bit of heat, but sweaty a lot. So it could be one of the others. But most people get a hot flush. Okay, hot flush is the main symptom. And I want to tell you that menopause. Okay, menopause is first, this name is first formed in Japan. And he realized that menopause, women 40-something, 50-something, before or while they're getting, or periods reducing and stopping, and they suffer from shoulder pain. So I want to tell you, menopause, it can cause pain, especially shoulder pain, especially neck pain. A lot of people didn't realize it, but this is how menopause they give a name of menopause. The diagnosis, it was in Japan. As a doctor have a lot of shoulder pain patient who's on similar age and figure out, oh, that's because the hormone change and causing shoulder pain. And with shoulder pain, they have more and more other symptoms, and now we only know, oh, menopause, that is hot flashes and night sweaty. Not just that, pain as well due to the hormone change. Okay, how long do hot flashes last? Well, hot flashes often come on suddenly, right? But how long any single hot flash lasts will vary. Some hot flashes pass after a few seconds, just few seconds, while a long hot flash may go on for more than 10 minutes. Wow, that's a lot, isn't it? On all average, hot flashes last about 4 minutes or 5 minutes. Now, what about the frequency then? Now we know about 10 minutes or more than 10 minutes, or one just a few seconds. Well, 10 minutes, few seconds, they're so different, right? Now, what about the frequency? How many times do you get hot flashes? That is also varies. Some women experience a few hot flashes per week. Some can go for once a month. I have patients go once a month. It's not a real problem for them anymore, right? While others may have several an hour, they have few hot flashes an hour. Some can go every 5 minutes. Every 5 minutes they get a hot flashes. Every 5 minutes they get a hot flashes, or every 10 minutes they get hot flashes. Some can usually because of the stress. When they have stress, they get hot flashes more. When they're more relaxed, they're all right. Some is just not. No matter where you are, how stressed or how relaxed you are, it just keeps happening. You can't not seem to be able to stop it. Right. Depending where you are in premenopause, that can change. Okay. So when you have a lot of frequency of it happens quite frequently, it can change due to the hormone change. It can go more or it can go less. So there are a range of treatments and lifestyle changes that may help lessen the symptoms and frequency of your hot flashes. Yeah, we will talk about it in the next few days. Tomorrow we're going to talk about what causes hot flashes. Right. Tomorrow we're going to talk about what causes hot flashes. Kia Clinic, hi, how are you? Thank you for joining us. Okay, now do you have any question about hot flashes? If you have any question, please, you can leave it down there. Okay, I think I have a happy day here. Say, what is a strategy to reduce frequent urination and can be the cause of low blood pressure? What do you mean can be the cause of low blood pressure? Oh, the cause of low blood pressure. We'll talk about that. This is a long topic. It's a very long topic for that. The strategy for reducing frequent urination. The frequent urination, first we need to know what to diagnose. Okay, so all the strategy you need to go to the diagnosis. What is the diagnosis? According to Chinese medicines. Now, if it's a kidney one, then 少阴太阳. In 少阴太阳image, you can image from here to here, wrist and ankle down. Any point from wrist down, ankle down. 少阴太阳. It can be for what? KP Yangming as well, because it's in here, right? It can be for 少阴 少阳 as well. Or there are a lot of strategy for it. It comes to what is your diagnosis. And the point is where I just showed you. Doesn't matter which one, which strategy you go, and those strategies are go for diagnosis, according to what diagnosis that you made for your patient. And this will be all on my webinar. You can pay and learn. Order the webinar and learn. It's all on there. Okay, and the person is diabetic. Yeah, the diabetic is still the same. So diabetic strategy is magical 12 or magical 8, magical 8 plus 1. Those are the two strategy that you may use to work out which diagnosis it is. And with magical 12, it already covered what I just mentioned, right? When this all means what I just mentioned, then for the patient, the main thing is frequency of urine, right? So on those 12 magical point things, and 少阴太阳, in 少阴太阳meridian, you can put more needle, choose some needles below the wrist and ankle to target frequency urine. This is how you come up with point strategy. Jin Lin Hua said, my patient 45 to 50 years, he feel hot. He, right? Not she, right? In the feet at night. 1 week. How do you think that kidney direct? I think that is level 2. Good one. So you have a diagnosis for it. That's pretty good. Okay. Now, hot flasher is not just happening in female. It can happen in male. Okay. So not people didn't know that. A patient who suffer from hot flasher, they get hot, and they didn't know what happened. It happened in men too, but varies. Very, very less. But you may see one too. Not often though. Not often. Okay, men, female menopause, men menopause. Okay. Now I want to tell you that feet hot at night time. If you need to pull out your feet out of your blanket, and that's quite normal. That's quite normal. But if that happens in certain age, okay, and if it happens at night time, if you put your feet out of the blanket, and that is okay, and it can lower it down, and you feel comfortable, go to sleep, and that's fine. Because most people are fit to get warm. That means you have a good heart conditions. Okay. Now, if your feet are cold, and that's a real problem. If your feet hot all the time, even during the day, you're awake, and that's a problem. Okay, that's a problem. So if just heat, you feel hot Oh, very warm. As soon as you put out your feet out of the blanket, then it's fine, and that is considered okay. But if your feet are warm all the time and hot or burning during the day, you can't wear socks, you can't wear shoes, and that's a problem. Then you need to treat it. And again, this is just a symptom. This is just a symptom. It doesn't mean that symptoms directly to connect to any of the organs. Any of the organs out of balance will be able to cause this symptom. So you have to go for which organ out of balance. You may need to take the pulse, see the tongue, and ask a lot of questions to figure it out, whether it's from kidney, liver, stomach, spleen, lung, or heart, which organ out of balance. It can be multiple organs out of balance, then you treat all the organs. The magical 12 from the image. And here, magical 12, which means you needle all 12 meridian, one meridian, 1 point, which you can use Harari point, which I shared with you already previously. One needle, each point on the Harari point. That's the first one. Then on top of that, if you want to treat the frequency urines, then Sao in Taiyang. If your diagnosis is Sao in kidney, then Sao in Taiyang, you needle over here, between here and here, here and here. You can choose 1 or 2 points on Sao in Taiyang, the extra needle of the 12 magical point. Okay. All right. That's it for today, and thank you for being here. Now, if you have more questions, please leave it down there, and I'll come back and reply to you. Thank you very much, and stay awesome. See you tomorrow. Tomorrow, we're going to talk about what causes hot flashes. Stay awesome. Bye.